In our world today, it is said that health is wealth. Everybody desires to live a healthy life, and being healthy or living a healthy life is a blessing. But sometimes disease may get in the way of our health and render us unhealthy. We're going to look at one particular disease that is known to almost everybody. And I guess from the title of the video, you know that we're going to look at cancer. Something funny is that where I come from in Africa, most people believe that cancer is a disease of the rich. Is it? We are going to deconstruct that false narrative so that no proud view of mine will ever say that cancer is a disease of the rich. What is cancer? Cancer is when the cells lose the ability to stop growing and dividing. The reason why my fingers are this long and not this long is because they know they have to stop growing at this point. But cancer cells are stupid, and I'm not apologetic for that. They behave like psychopaths. They actually lose the ability to know when to stop growing. They just grow and grow and grow until a tumor forms. There are two types of tumors, and we'll get into that along this presentation. Don't worry, we are going to look at them as we progress with this presentation. So look for a pen and a paper. There's a lot of writing you're going to do so that you won't forget. Cancer cells do not care about their surrounding. They are opportunists. They want it all. They deprive other cells of blood supply, nutrients. They destroy their surrounding and the society of the host. Scientifically, cancer is said to be caused by failure of genetic mechanisms that control cell growth and proliferation. You know, our cells have a DNA that contains sets of instructions on how a cell is supposed to grow, so damage to DNA may prevent it from repairing or instructing the cells to die. We call these mutations. And mutations can be beneficial, can be neutral, and also can be harmful. It just depends with where the gene mutation occurs. And it's amazing that our bodies typically repair most of these mutations. So unpaired DNA due to mutations may cause cells to grow uncontrollably. So mutations don't occur overnight, in a day, in a week, in a month. No, they build up in the cells of your body over time. Ladies and gentlemen, boys and girls, I want you to understand that a single mutation will less likely cause cancer. So cancer occurs from mutations that are built up over lifetime. That's why cancer is common in older people. The longer you live, the greater the chance of you developing any type of disease. Cells that have multiple mutations will stop working normally, grow out of control and become a tumor. Remember earlier I told you that there are two types of tumors. That's benign and malignant tumors. The benign ones are usually not dangerous. They are non-cancerous, and they are named according to the tissue of origin and with the suffix "oma." So examples are lipoma, hemangioma, leiomyoma, chondroma, and so on. The second type, which is malignant, these are dangerous and they are cancerous, and they are named according to their tissue of origin. Cancers that arise from epithelial cells are called carcinomas. For example, adenocarcinoma from glandular epithelium, and cancers of muscles and bones are called sarcomas. For example, osteosarcoma, chondrosarcoma, rhabdomyosarcoma, and cancers of blood-forming cells are called leukemias. Leuc from leukocytes. The most common type of cancer in women is breast cancer, while in male, prostate cancer is the most common type. Lung cancer and colorectal cancer are common types of cancers in both men and women. Other types of cancer may include esophagus cancer, stomach cancer, bladder cancer, Hodgkin's and non-Hodgkin's lymphoma, ovarian cancer, all types of leukemias, brain cancer, kidney cancer, liver cancer, multiple myeloma, and mesothelioma that normally occurs from exposure to asbestos. There are so many: malignant melanoma, skin cancer, oral cancer, cancer of the uterus, cervical cancer, endometrial cancer, cancers of the bone and connective tissues. The heart is the only organ that doesn't develop cancer, although sometimes some benign tumors may form, like they call it myxoma, and also may be affected by complications that come as a result of cancer or cancer treatment. Some malignant cells may metastasize to the heart and kickstart disease process or even cause life-threatening problems. There are two basic types of gene mutations. One of them is acquired mutations. These are the most common cause of cancers. They occur from damage of genes in a particular cell along or during a person's lifetime. It may occur in any cell, as I said before, maybe breast cell, maybe brain cell, maybe colon cell. So they go ahead and multiply many times and form a tumor. We call this hyperplasia. Sporadic cancers is the name given to cancers that occur as a result of acquired mutations. Even though I said that they might occur in any cell, they may not occur in germline cells at all, which means that they cannot be inherited, or in simple terms, they cannot be passed from parent to child. So some of the factors that might lead to acquired mutations or sporadic cancers include any form of tobacco consumption, UV light radiations, viruses like Epstein-Barr virus, HPV virus, and also HIV. There's this type of cancer associated with HIV. It's called Kaposi sarcoma. The other factor that might lead to sporadic or acquired mutation is age. The longer you live, the more the mutations accumulate and the greater the chance of you developing cancer. And the second type are germline mutations. These are less common. They occur in either the egg cell or sperm cell. They are inherited, which means that they are passed from a parent to child during the process of conception. As an embryo develops into a baby, mutations from the initial sperm cell or egg cell are copied into every cell in the body. Because these mutations affect reproductive cells, they can be passed from generation to generation. Cancers that occur as a result of germline mutations are called inherited cancers. They are less common or they are rare, and they account to about 5% to 20% of all cancer cases. There are many genes that could contribute to formation or development of cancer, like tumor suppressor genes. Examples are BRCA1. Some people, in order for them to remember them quickly, they normally call them BRCA1. There's also BRCA2, P53, also known as TP53. So these are protective proteins. They limit cell growth in these ways or in these mechanisms. Number one, they monitor how quickly cells divide into new cells, and also they help in the repair of mismatched DNA, also control dead cells. When mutations occur in these genes, these processes will grind to a halt. Cells will grow uncontrollably. There will be no monitoring of cells. They'll just be growing anyhowly. There will be no repair of mismatched DNA. What will ensue? Formation of a neoplasm. Let me not confuse you. A tumor sounds familiar, right? Germline mutations in BRCA1, BRCA2 genes increases the risk of developing breast cancer and ovarian cancer in ladies. It also increases the risk of developing prostate cancer and breast cancer in men. And in both men and ladies, it increases the risk of developing pancreatic cancer and melanoma. P53 or TP53 is the most mutated gene in patients with cancer. About 50% of cancer patients or cancer cases, these patients have a missing or damaged P53 genes, and most of these mutations are acquired. Something to remember, as I said earlier, most mutations are acquired compared to germline. And also research has shown that most patients who carry these genes are at a more increased risk of developing other types of cancers. Then we have oncogenes. These turn a healthy cell into a cancerous cell. They are not inherited. HER2, I normally call it HER2, is one of the commonest type of oncogenes. It is involved in cancer growth and cancer spread. So they may be found in some cancer cells like cancer of the breast and the cancer of the ovary. We also have RAS. otherwise known as a RAS family of oncogenes involving different functions in the cell like communication pathways, cell growth, and cell death. We also have DNA repair genes. As the name suggests, they repair or fix. What are they repairing? Mistakes that were made when DNA was being copied. We saw this when we are looking at tumor suppressor genes, and the examples were BRCA1, BRCA2, P53. So if mistakes are made in the DNA repair gene and they remain uncorrected, mutations will form. And what will ensue? Cancer, particularly mutations in the tumor suppressor genes and the oncogenes. So as I said earlier, they may be inherited or acquired. Let's now look at cancer stages. There are different types of staging systems that doctors normally use for different types of cancers. And we'll begin with the number staging system. Stage 0, the tumor is still in situ, is still at the place where it started and it hasn't spread anywhere. And then stage 1, the tumor is small and hasn't spread anywhere. And stage 2, now the tumor is big but hasn't spread anywhere. Stage 3, the tumor is big and has spread to the lymph nodes. The lymph nodes are part of your immune system. Stage 4, this cancer has spread to distant organs, at least one organ. We call this secondary cancer or metastasis. The second type of staging system that we have is called D and M staging system. This one now uses numbers and letters to describe the type of cancer or tumor that you may be having, and it may be used differently depending on the type of tumor or cancer that you may be having. T is for the size of tumor with numbers 1 to 4. 1 meaning that the tumor is small and 4 meaning that the tumor is large. N is for lymph nodes with numbers 0 to 3. 0 meaning that no lymph node is affected by cancer, and 3 meaning that many lymph nodes have been affected by cancer. And lastly, we have M. M is for metastasis, meaning that cancer have spread to other distant organs with numbers 0 or 1. 0 meaning that no metastasis, and 1 meaning that cancer has spread to other distant organs. So what are the risk factors of cancer? Most people with cancer are always desperate to know what could have caused their disease. Is this something that they did? Is this something that they could have prevented? A previous history of cancer, especially for germline mutations, is the strongest risk factor. In fact, there's a study that was done in Denmark. It showed that people who have been diagnosed with cancer previously are at increased risk of developing cancer compared to people who have no history at all. Another risk factor is age. As I said earlier, the longer you live, the greater the chance of you developing any type of disease. So mutations accumulate over time and they eventually become cancerous. Another risk factor is family history, especially for first-degree relatives. Who are your first-degree relatives? Your father, your mother, your siblings, this is your brother or sister, your child. I want you to understand that having a relative who has cancer is not a guarantee that you will have cancer. In fact, most people who have relatives with faulty genes usually normally don't inherit them. So the strength of family history depends on who in your family was diagnosed with cancer, what type of cancer were they diagnosed with, and at what age were they diagnosed with this cancer, how closely related these relatives were. The greater the number of relatives who are diagnosed with the same type of cancer or related cancer, that's from your father's side or your mother's side, and the younger the age at which they were diagnosed with cancer, the greater the risk. If, for instance, your relative was diagnosed with cancer or was found to have a faulty gene, we normally recommend you to screen before the age of 45, like in the case of breast cancer and colorectal cancer. And in some instances, some people are diagnosed with cancer when they are much younger, like the case of Chadwick Boseman, who was diagnosed and died of colorectal cancer at age 40. So in this case, we normally recommend you to screen 10 years before the age at which they were diagnosed with cancer. Some other risk factors, especially for acquired mutations, may include smoking, obesity, alcohol consumption, viruses such as HPV, HIV, and also exposure to chemicals like asbestos, arsenic, benzene, beryllium, nickel, and exposure to UV radiations from the sun. Let's now finalize by looking at cancer treatment. When treating cancer, we normally choose the best therapy that optimizes the amount of tumor cells to kill and minimizes the damage to normal cells that may be affected by cancer treatment. So cancer treatment may depend on the stage of cancer. There are three primary cancer treatments. That is surgery, radiation therapy, and chemotherapy. So if the cancer is slow growing, it may need surgery or local treatment. And if the cancer is fast growing and invading neighboring tissues, it may need radiation therapy followed by surgery, or surgery followed by radiation therapy. Radiation therapy has or uses X-rays that kill individual cells. And if the cancer has spread to distant organs, or it's all over, or it's everywhere in your body, your doctor may recommend chemotherapy or a combination of chemotherapy and radiotherapy. Chemotherapy has chemicals that kill individual cells, but they also have side effects. Radiation therapy and chemotherapy work by shredding the cell's DNA or disrupting the coping mechanisms. Neither chemotherapy or radiation attack only cancer cells, they also attack other cells too. Chemotherapy normally kills cells that grow rapidly, so you are likely to experience side effects in these three areas. Your bone marrow, which typically has cells that normally regenerate. So a patient is likely to experience low blood cell count and also frequent infection. Your GI system and your mouth are also other areas that have a high cell turnover. So patients normally have mouth sores and also may experience diarrhea. Another area that is usually hard hit is your hair follicles, particularly those on your head. So someone may ask, why do cancer patients normally shave? I want you to understand that cancer itself does not cause hair loss. Is the side effects of chemotherapy treatment. So some patients may want to be in control. They don't want to wait until they start losing their hair, or they don't want to be reminded always that they have cancer when they see their hair everywhere. And also when the hair starts falling off, it becomes so inconvenient. It sticks on every surface. It clogs bathrooms. And also it's an indicator that I am a cancer patient on treatment or undergoing treatment. Another area that may be affected is your skin. You may have skin rashes. Other symptoms may include weight loss, fatigue, and pain. Other forms of treatment that are worth mentioning are neoadjuvant treatment. This is a treatment given before primary treatment, and the goal is to make primary treatment effective, and may include chemotherapy, radiotherapy, or hormone therapy. Then we have primary therapy. The goal of this treatment is to completely remove cancer or kill cancer cells, and they may include some of the treatments we had mentioned before, like chemotherapy, radiotherapy, but mostly primary treatment is surgery. We also have a bone marrow transplant, otherwise known as stem cell therapy, where your bone marrow is taken, or bone marrow from another person is filtered, then either given back to the donor or given to another person to replace a diseased bone marrow. Another form of treatment is immune therapy, also known as, or otherwise known as biological therapy. This one now uses your immune system to fight cancer. Cancer may have some mechanism that may prevent it from being recognized by the immune cells. So there are drugs called monoclonal antibodies. They end in MAB. It's laboratory produced molecules that when taken in, they act like antibodies. So they help flag unwanted cells in your body, like cancer cells that may be masquerading like your normal cells, to be attacked by the immune system. They can also stop cell growth. They also prevent vascularization of tumors, and also they can help deliver chemotherapeutic drugs and also radiation treatment. Another treatment is hormone therapy. Some cancers like breast cancer or prostate cancer may be ignited by hormones. So lowering their levels or blocking their effect may prevent the cancers from growing further. Other forms of treatment may include targeted drug therapy. There's a cryoablation. This is where we use cold temperatures to kill cancer cells. There's also radioablation, photodynamic therapy, and also adjuvant treatment. This is a treatment that is an additional treatment to primary treatment that will ensure that cancer does not occur again. Then there's palliative treatment. This type of treatment helps cancer patients deal with side effects that may have been caused by other forms of treatment and signs and symptoms that may be caused by cancer itself. There are also other treatment methods still in clinical trials, and we hope they get through. Treatment of cancer alone is not enough. Think about their mental health is affected, their normal way of life. So they may need mental health therapy. They may need emotional support. They may need financial support. They may need physical support, and they may need spiritual support. And I want to leave you with this. Please try go get a medical checkup at least once in a year. early diagnosis and treatment of cancer will have a better outcome.